Hello and welcome to the Pain-Free Living Podcast. My name's Bob Allen and my aim is to help you to live pain-free. Let's begin. Hello and welcome to the Pain-Free Living Podcast. I'm Bob Allen.
I'm Louise Gordon.
I'm an osteopath, graduated in 2011 and I've been helping people at pain since that date.
I am a change coach and consultant, so I work with people and businesses to navigate change, and I'm here to ask you, Bob, all the questions.
She certainly is. And today we're going to be talking about the difference between a chiropractor, an osteopath and a physiotherapist, something I get asked a lot. It sounds like the start of a really bad joke, but let's get into it and see where we go from there.
So, Bob, what is the difference then between an osteopath, a chiropractor and a physiotherapist?
Louise, I knew you were going to ask me that. Instinct, I think. Where to begin? To start with, they're all protected titles. To allow yourself to be called an osteopath, physiotherapist or a chiropractor, you have to have completed a certain number of years of training. We are all regulated by different authorities. So for an osteopath, it's the General Osteopathic Council. For chiropractors, it's the General Chiropractic Council. And for physiotherapists, it's the HCPC, and I can't remember what that stands for. But yes, so we all have regulatory bodies. And if you have any concerns about the qualifications for the therapists you're going to see, you can look them up and it will have all their details, when they graduated, etc., etc. In terms of qualifications, we're all highly qualified. The main difference between osteopaths, chiropractors and physiotherapists, I can speak from an osteopathic experience because that's what I did. So the degree course was 4 years full-time or 5 years part-time, which is the version that I did. We do lots of ologies. We do physiology, biology, pathology, and loads of ologies. And we have a minimum of 1,000 hours of actually working with clients. So that's all part of the training that we do. For chiropractors, it's something similar. Again, it's a 4 or 5 year qualification period, and I can't really speak for what's involved in the course because I'm not one. But, you know, they cover the similar sort of things to what we do. Physiotherapy, they do between 3 and 4 years on their degree course. And yeah, that again, they're fully regulated. Again, I can't really talk about what they do because I don't know, but, you know, it's very exercise based.
What is it that got you into osteopathy?
There's a question. So, way back when, a family member had some muscle and joint problems. They'd gone through the NHS and hadn't had great results. I was chatting about that to a friend and they suggested taking them to an osteopath. I'd never heard of osteopathy, didn't have a clue, so took them along to an osteopath and they were treated and things improved. Really fascinated me. Never seen one in action, didn't really know what they were going to do. And there's lots of muscle and joint movements. I asked lots of questions and it just triggered something somewhere and I thought, this is really interesting. So I then went back to see the osteopath a couple of times without my family member and yeah, just kind of got drawn into it. The job that I was doing at the time had stopped being fun and I was looking for something else. And then I thought, oh no, I could do this osteopathy thing. So that's what I did.
Wow. And no looking back?
Lots of looking back and thinking, oh my God, I didn't realise how hard it was going to be. But actually, yeah, it's all been worth it.
And it's a massive change from what you did before as well, isn't it?
It is, yeah. 20 years of computers, that's what I did. So yeah, time for a change.
Coming back to then the difference between an osteopath, chiropractor and physio, we've talked about obviously there's the training element. What's the difference in terms of the approaches of them?
The approach is actually very similar, but in terms of what we're taught, that's very different. So as an osteopath, we get taught to look at all of the body systems. We take a detailed case history, which all therapists do, but we are taught to look quite holistically at the body. So we will look at all the different systems. We'll look at muscles and joints. Although I think holistic is an overused term, it's very applicable to osteopaths because that is what we do. Chiropractors are trained and taught with a slightly different philosophy. So for a chiropractor, because the body is pretty much controlled by the nervous system, Nerves go to the organs, to the muscles. They send information back to the brain. The theory behind chiropractic is that as long as the nervous system is working and functioning correctly, then the body will function correctly. So they are very specific about working with the spine and the nerves going into and out of the spine, just in case there may be some nerve compression, some restriction in joints, which can potentially affect how the body works and moves. So that's the chiropractic side of things. And for physiotherapists, physiotherapy is very much exercise-based, exercise and rehabilitation techniques based. So it's more focused on actually using exercise as an aid to recovery.
Is there one approach that is better than the others?
Osteopathy, obviously. But taking my osteopath hat off, I would say that no, there's no one best approach, because different things work for different people, which is why acupuncture can work for some people, crystal healing works for some people, angel therapy works for some people. So all of the different things have benefits. So it doesn't really matter what somebody practices. The thing about osteopathy, chiropractic and physiotherapy is that they are all regulated. You know, there are certain standards that we have to adhere to. So we have to do 30 hours of CPD every year. And there are other things that we have to comply with. We have a regulatory body that will make sure we are maintaining that certain standard. So that's one of the key things about what we practice. But as long as we adhere to that, there is no one best approach. So it's very much down to the practitioner.
So how then do you decide, or what would your advice be in terms of, deciding which one do I see?
Yeah, I mean, it's a good question. So I would say that the best way to decide what therapist to see is talk to them. Well, talk to family and friends, ask about recommendations, because if you just Google something, who knows what's going to come up. So talk to family and friends, see if they've got any recommendations or anyone they've heard of that's quite good. And for smaller practices, talk to the person you're likely to be seeing. Let them know what the problem is and ask them about potential treatment approach, those sorts of questions. And if they give you the answers that satisfy you and you think that sounds like a person who I could go and see, then go and see them. You know, try a couple of treatments to see if it works for you or not. If, on the other hand, you speak to them and they try and come out with a lot of terms that you don't understand, then probably want to look for somebody else. If it's a bigger practice, then you generally don't get a chance to talk to individual practitioners, but go for an appointment and you will get a feel for whether that's a person that you can work with and could help you.
So I guess my takeaway then from your obviously sharing the differences and what to look for, the takeaway pretty much is you being comfortable with whoever you decide to seek treatment from.
Yeah, and when you go and see a therapist, they should give you a treatment plan. They should explain what they think the problem is. They should explain what they're going to do about that. And if you've seen them a couple of times and they don't seem to be making progress, then they should be happy to review what they've given you, what the process you've gone through, and then revise it. You know, if you've been going to see someone for a number of treatments and they don't seem to be making a difference, ask why not. Ask them what the alternatives are, and they should be happy to explain why they're doing what they're doing, and if things need to change, then they should be happy to change that as well.
Great. So thank you, Bob. Thanks for clarifying the difference between the three. I've learnt something new there.
Good. In a nutshell, that is the difference between an osteopath, a chiropractor and a physiotherapist. If you want to know more, feel free to reach out and get in touch. All social connections will be in the show notes. If you've got any questions, then again, please feel free to get in touch. If you found this podcast useful, tell all your friends, tell your family. Please subscribe, leave a review, and the more people that get to hear about this, the more we can spread the message of what pain-free living is all about. Thanks for listening. Okay, we've come to the end of the episode. Hope you enjoyed it. Hope you learned a few things. And please tell all your friends, like and subscribe, and I'll see you next time.